Hi everyone, and welcome to tsfibro. Today's video is number 12 on the Introduction to Fibromyalgia, Forgetfulness, or what we call Fibro Fog. If you haven't already, please consider subscribing to my channel. Hit the red button that says subscribe. Click that notification bell next to it, and then you'll get notifications of videos the new videos I put up. If you like my video, give me a thumbs up. Okay, today, forgetfulness, which is probably the most irritating symptom of fibromyalgia. It irritates the crap out of me. It's called Fibro Fog. Have you ever forgotten where you put your keys? Having trouble remembering what you were supposed to do this afternoon? Do you have difficulty finding the right words to use to express yourself? If you are experiencing some or all of these memory problems, you may be suffering from fibro fog. Fibro fog refers to a variety of cognitive impairments that fibromyalgia sufferers experience in this disorder. Fibro fog can be one of the most stressful and upsetting fibro symptoms. If you know someone with fibromyalgia syndrome, or if you are suffering from the illness, keep an eye out for the indicators of fibro fog. What is fibro fog? Fibro fog is a term given to the variety of cognitive problems that many fibromyalgia sufferers face during their illness. Fibro fog encompasses memory loss, difficulties using language, difficulties with learning. These symptoms tend to descend in a haze or fog around the sufferer. Fibro fogs can occur at any time and can vary in intensity when they do occur. Fibro fogs tend to be at their most severe during flare-ups in pain. Fibro fog affects both men and women who have fibromyalgia pain, though it tends to hit more women more often. Women between the ages of 30 and 50 are most likely to be affected by fibro fog. Episodes of fibro fog typically last only a few days, though sometimes severe fibro fog can last for weeks or even months. Symptoms of fibro fog. Fibro fog is one of the most common yet unrecognized symptoms of fibromyalgia. If you have fibromyalgia signs and symptoms, it is important to be aware of fibro fog so that you can seek appropriate treatment and manage your illness more effectively. Some of the symptoms of fibro fog include short-term memory loss, difficulty remembering where you put things, difficulty remembering plans, difficulty with language, including trouble holding conversations, understanding conversation, and expressing thoughts. Difficulty finding the right word to use in a conversation. Trouble remembering simple numbers. Transposing letters and numbers. Trouble concentrating and focusing. And trouble retaining new information. Causes of fibro fog. The causes of memory loss and fibro fog are as yet undetermined. However, a number of factors could be at the root of these cognitive impairments. It is imperative that there is no real problem with the mental capacities of people suffering from fibro fog. Instead, there must be an underlying problem that causes the brain to be unable to complete memory functions. Sleep deprivation. Sleep disorders are one of the primary fibromyalgia signs and symptoms. Lack of adequate sleep can affect the brain's ability to produce enough of the neurochemical serotonin, which aids in laying down memory. Decreased blood flow. Studies show that fibromyalgia disability can cause decreased blood flow to certain areas of the brain responsible for creating short-term memories. This lack of blood flow may prevent the brain from adequately creating new memories. Chronic pain. The chronic pain caused by fibromyalgia may actually inhibit the brain's ability to create memories. Processing pain signals take up a lot of the brain's time and energy, especially in someone with fibromyalgia. This excessive pain may therefore reduce the amount of time the brain spends on trying to form new memories. Pain also produces large amounts of stress, which can be one of the causes of short-term memory loss. Depression. A large percentage of people with fibromyalgia also report that they suffer from anxiety and depression. Depression and memory loss definitely seem to be linked. Depression lowers the level of serotonin in the brain, preventing new memories from being laid down. Low levels of serotonin are also linked with learning disabilities. Effects of Fibro Fog on fibromyalgia. Fibro Fog tends to have negative effects on fibromyalgia symptoms and the course of the illness. Fibro Fog can cause people with fibromyalgia to forget important self-care techniques, including stretching and exercise. This can cause the pain of fibromyalgia to become worse. In a recent study involving people with and without fibromyalgia, those with fibromyalgia reported more trouble with memory, concentration, mental confusion, and speaking. Patients with Fibro Fog also complain of more pain, increased fatigue, and more difficulty sleeping. Frustrating Fibro Fog. Fibro fog, also known as brain fog, is something that is both frustrating and difficult to deal with for people with fibromyalgia. While we associate pain and fatigue with the condition, and we're glad to talk about that, almost as common is the lack of clarity and mental confusion that can be a daily occurrence. Some possible reasons for Fibro Fog. Several reasons have been postulated as to why people with chronic fatigue and fibromyalgia suffer with this maddening symptom. Cognitive difficulties that make remembering things, staying focused, and using speech appropriately a challenge have been attributed to a number of concurrent physiological processes. It was long thought that Fibro Fog was a psychological problem. However, several research studies and much speculation have turned up other possible causes. What we know now is that Fibro Fog has nothing to do with a person's mental capacity, although it may be influenced by a lack of oxygen to the brain. What are some possible causes for Fibro Fog? Depression. Decreased oxygen flow to the brain, certain medications, poor nutrition, changes to the nervous system, and pain. What the experts are saying. In fact, Fibro Fog is a type of mental exhaustion, and it is exacerbated by pain and lack of restorative sleep. One of the more popular theories have been that Fibro Fog is caused by sleep deprivation. At the deepest level of sleep, delta wave sleep, a person's mind is able to sort data, file it appropriately, and discard unnecessary information. The ability to get sufficient delta wave sleep, a real issue for fibromyalgia sufferers, causes impairment of the ability to recall information at normal level of mental efficiency. Brain scan studies have indicated that at times people with fibromyalgia suffer oxygen deprivation to various parts of the brain, possibly due to central nervous system malfunctions that cause changes in blood vessels in the brain. Recent research show that the brain may be affected by chronic pain. Using functional MRI technology, researchers discovered that the parts of the brain most associated with emotions fail to shut off when they should in people with chronic pain. In other words, their brains are running all the time and become exhausted. Neurons are wearing out and the balance of the brain is disturbed. It's little wonder that people with fibromyalgia who deal with fibro fog feel like they are mentally exhausted so often. It appears that physiologically they may well be. Research is ongoing and a wide variety of theories are coming to surface. What you can do to get a good night's rest. In the meantime, there are things you can do to diminish the impact of fibro fog. Since it does connect directly to non-restorative sleep, it is important to do what is necessary to address the sleep issue. Along with a high-quality mattress and pillow and a sufficiently dark and comfortable room, some of the following suggestions may be useful. Stay on a routine, retiring and rising at the same time every day. Make sure the atmosphere around bedtime, both going to sleep and during sleep, is relaxing. No caffeine before bed. If you must eat, eat lightly. Listen to white noise prior to sleep and keep it on during the hours you sleep. Natural sleep aid. Talk with your doctor about that. Living with fibro fog, helping yourself. According to the Arthritis Foundation, there are some things you can do to help yourself lessen the negative impact of fibro fog through the day. Repeat yourself. Repeat things to yourself over and over and over again. Repetition will keep thoughts fresh in your mind. Write it down. Whether you write in a calendar, a notebook, or sticky notes, if you're afraid you'll forget something, write it down. Pick your best time. If there is something you need to do that requires concentration and memory, pick your best time to do it. Many people with fibromyalgia find early in the day to be their best time. Get treatment. Depression. Pain and sleep deprivation can influence your ability to concentrate and remember. Getting your medical problems treated may indirectly help your memory. Engage yourself. Reading a book, seeing a play, or working a complex crossword puzzle or a jigsaw puzzle can stimulate your brain and your memory. Stay active. Physical activity in moderation can increase your energy and help lift your fibro fog. Speak to your doctor or physical therapist about an exercise program that is right for you. Explain yourself. Explain your memory difficulties to family members and close friends. Memory problems often result from stress. Getting a little understanding from the ones you love may help. Keep it quiet. A radio blasting from the next room, a TV competing for your attention, or background conversations can distract your attention from the task at hand. If possible, move to a quiet place and minimize distractions when you are trying to remember. Go slowly. Sometimes memory problems can result from trying to do too much in too short a period of time. Break up tasks and don't take on more than you can handle at once. Stress and fatigue will only make the situation worse. Fibromyalgia does not have a magic pill or a shot you can take to deal with the flow of symptoms and challenges. Fibro fog is but one of many things people with fibromyalgia have to contend with, but using a combination of treatment disciplines seem to help. Like I said in the beginning, fibro fog is the most aggravating symptom to me of fibromyalgia. I'm not saying it's the worst because pain and the fatigue to me are worse, but it is so aggravating. And the more you forget, the more aggravated you get. When I leave a room to go get something, I have taught myself, okay, I'm going to get the broom, 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 over and over till I get the broom. Because when my fibro fog is acting up, just leaving the room, forget it. My poor husband, he has to sit there and listen to me tell a story, or I'm telling him something, and the TV will be on, and I look up at the TV, and I quit talking without even realizing it. And he goes, "Are you going to finish your story?" And I'm going, "What story?" And then he'll remind me, "Oh, yeah." And at first, I know it was aggravating him. He knows now I can't help it. Forget talking to someone, especially someone you don't know, and you start talking and then you forget what you're talking about. So you kind of wait for them to start talking again, so maybe you can pick up on what you were talking about so you don't look like an idiot. Or you start talking and you forget words. I mean, the simplest word, cat, dog, plane, anything, you're talking and all of a sudden you have to stop because you cannot think of the word. It is so simple, but so aggravating. So, all of you out there with Fibro Fog, the more agitated you get about not remembering what you were going to get, or not remembering you were supposed to do something, forgetting a doctor's appointment, not thinking of a word when you're trying to, the more agitated you get, the more stress it causes, and the more you'll forget. So sometimes you just have to stop, take a breath, and start over. What is something that is you forgot, or like my most probably embarrassing moment with the Fibro Fog is that I'm getting ready to go to a doctor's appointment, and I'm talking to my friend on the phone, and I'm rushing around the house, and I'm breathing heavy, and she goes, "Are you okay?" I said, "No, I gotta be out of here in 10 minutes, and I can't find my phone." Talking on it. So that's probably one of mine. I have lots. What's one of yours? Leave me a comment below and tell me what one of yours was, because I would love to know. I'm not the only one out there who totally looked like an idiot on the phone with my friend. Anyway, thank you everyone for listening to my video. I hope you enjoyed it. If you did, give me a thumbs up. Don't forget to subscribe. Hit the notification bell so you can be notified of when I put up a video. Thank you. Thank you. Thank you so much, everyone, for listening to my videos. If you have any ideas, comments, or suggestions, I would love to hear it in the comment section below. Okay, everyone, have a great day. I pray for a cure, and I pray you have a pain-free day. God bless everyone.